Hello, I am Dr. Hadian. I am a cardiac electrophysiologist. My specialty is taking care of heart rhythm disturbances. No matter what I do, the heart is a muscle that has a certain time it has to work and then it stops. The goal is to make maximum out of what God has given us, to improve longevity and quality of life. Not everywhere in the heart we can burn, and not always we can cure. There is something written on the statue of Pierre Elliott Trudeau: to cure sometimes, to relieve often, to comfort always. In electrophysiology, we want to cure always. We try. Imagine a car going maximum speed that burns the engine. Our heart is a muscle that has to beat 100,000 times per day. When you get arrhythmia, it is beating irregular, out of sync, and much more. It can wear your heart muscle. You can get what we call it cardiomyopathy, which is disease of the heart muscle, and you cannot reverse it anymore. AFib is the most prevalent arrhythmia in adults. And this arrhythmia can be at times disabling, at times affecting the quality of life severely. At times it can be asymptomatic. The atrial fibrillation is basically chaos in the upper chambers of the heart. Rather than one circuit, one commander-in-chief commanding the heart to beat regularly and appropriate, is like an insurrection, different foci in the heart, different areas giving electrical impulse at different times, different places. So total chaos. Cardiac ablation is the process by which we ablate or terminate the wrong circuits in the heart. Ablation therapy is an invasive procedure. Medications suppress arrhythmia, but they don't cure it. Ablation, on the other hand, by accessing the heart directly through the wires and cauterizing the wrong circuits, cure it. There are many things we can do to make our heart last longer and beat better. By taking care of ourselves, by controlling the blood pressure, by making sure we eat healthy, the weight is okay, we don't have sleep apnea, and in other words, improving our general health, will be less prone to AFib and flutter. Anytime, if anything in your body you think is not right, to check it with your doctor. It is always good to have an expert opinion. If you feel palpitation, if you feel something is not right in the chest, you see your primary doctor. They do EKG, they check you by physical exam, and then they can take the appropriate steps, if needed, to refer you to an electrophysiologist.